The monthly office hours are designed with the family workforce in mind. Our first set of series targeted for the family-run executive directors and family leaders. NFSTAC wishes to support all of the family support workforce. So in order to accomplish this, we will be hosting additional sets of series for other family support workforce staff as we continue along. Office hours was developed as an outcome of the listening sessions we conducted last winter. They'll be held the fourth Thursday of each month at this time. Before we start our interactive conversation today, I would like to go over a few housekeeping items. Today's conversation is being recorded. The recording and any additional resources will be uploaded to our NFSTAC website under the Events tab. If you have any difficulties, please type your comment and someone will be able to assist you. Please also type your questions for the presenters in the chat box. We'll be watching the chat box during the entire presentation, and please ask questions. This is a great time to ask and get your questions answered. Our goal for the office hours is to encourage a conversation between our guest presenters and all those in attendance. We encourage you to ask those questions, like I just said. We'll unmute participants after the presentation portion is complete. If you can use the raise your hand button, that would be very helpful. NFSTAC hopes you will leave this event invigorated and with new ideas to help you do your work. We'll be following up with notes from the session and a packet of examples of written policies from our presenters today, along with other fellow affiliate executive directors that have given us permission to share with you. Feel free to use these as a template or a starting point for your own organization while you write your policy or upgrade. We ask that you take the time to complete a short feedback survey using the link provided at the end of this presentation. The survey will help us continuously improve our events, and it also fulfills our SAMHSA funding obligations to provide them with important data required by our contract. Please note, all information will be confidential and we will respect your privacy. We do not offer CEU credits for our events, but you will receive a certificate of attendance after the survey is completed. I would like to thank SAMHSA for allowing us to share this information with you today, and thank you for joining us. Now, it's exciting. At this time, I would like to introduce our expert industry panel of family-run executive directors. They'll tell you more about themselves and share their insights on developing policies that fit with today's culture. As the presentation begins, we encourage you to ask those questions in the chat and after their presentation. Can you tell I want this to be an open dialogue? I hope you enjoy. Lisa?
Thank you, Gail. And thank you for the opportunity to be part of this panel. I think it's going to be really good and really interesting. So policies sound really boring, but they're really important because they sort of reflect the values of organizations as well as all the necessities that you have to grapple with. So we did a lot of soul searching at our organization as a result of the impact that COVID had on us and some of the changes around us. So I'm sort of talking about what kind of changes we made because of the times around us. Next slide. So one of the things we took a big look at was bereavement. We lost a lot of people here in Massachusetts as a result of COVID. We were one of the states that was hit early. There were a lot of cities where people were, lived together in fairly close proximity. And there were a lot of reasons why there were a number of deaths of many young families, but many extended families as well. And so we originally had a policy, which some of you may still have, and you can see it over there on the left, our old bereavement policy. And we named, that the person that you were allowed to take bereavement time for had to be in these specific categories, spouse, partner, et cetera, et cetera. And you could only take up to 3 days. But we had people coming in and they would say, my uncle's been living with us and he passed away. And then for some of our youth who identify as LGBTQ and identify family differently, they would say, gee, so-and-so is very ill, or I've lost so-and-so who was like an extra family member to me. And so we searched and we looked and we talked to other organizations who were changing their bereavement policy, and the one on the right is what we have changed it to. And it's called, in the event of the loss of life of a family or chosen family member. So the staff person defines that, and they bring it to the supervisor and they say, this person was as like a mother to me, like a father to me, like a brother to me, whatever description they want to use. And we're giving up to 15 paid days to be used. So that's 3 work weeks within 12 months. So once you take a bereavement day, you have a 12-month clock. Nobody has taken more than 4 days this year or last year once we instituted this. But it is much more reflective of our values, because we value family and we value the connection that people have with family. And so we wanted to have that policy reflect those values. Now, I did bring this to our board of directors because this is extra cost to the organizations should suddenly 10 employees take 15 days. So we had to talk it through, but we really felt this was the right way to go. Next slide. The other thing we did fairly early on is we had in our budgets, like many of you do in contracts, mileage. And nobody was going everywhere. People were working from home. They were doing a lot of different things that were additional expenses for them at home, but they weren't using mileage. So with a discussion with many of our funders, and also we have the ability to shift lines up to a certain percentage of costs within our state contracts. It's just one of those things they allow, because they don't want to spend extra time, okaying really small changes. We created what we call a technology or home office stipend. It is a standard amount of money for full-time employees, less for part-time employees. And when we were fully remote, we were really clear to people that it could be used for these different expenses. Maybe you had to buy a better internet package. Maybe you needed more data on your phone if you were using that. Maybe you needed one of those fancy lights you put to light up your face when you're on Zoom. We did ask people if they were using supplies such as copy paper or whatever, that they use the supplies from the office first before going out and racking up new costs. But, and we wanted to be clear that it has to be a reimbursement cost, because if the stipend to them says reimbursement from us, then the IRS requires that not be some sort of a stipend, well, not a stipend, some sort of honorarium or something like that. It really has to be a reimbursement check. Again, we had a discussion about this at our board level and obviously within the staff. Now, we did get some pushback. We had one staff person say, well, I'm going to be using a lot more air conditioning, so I think you should help me out with my air conditioning during the summer. And another, I can't remember. We had some conversations like that. So we had to be really clear what the stipend was for and wasn't for, though we're not monitoring everybody, but we had to have a clear kind of discussion. As I mentioned, all of these new policies were brought to our board, and we have, like you have, a lot of parents on our board, so they get it. They get why we'd want to make these changes. They get why we'd want to have policies that reflect our value. But we had to talk about the fiscal impact, and we also had to talk about, will it help us to retain staff? We've had a lot of turnover during COVID, but this did help us to retain a lot of valuable staff for quite a long time. The last thing I'm going to mention, which isn't on here, but it's underway, and I'd be happy to talk about it in the discussion, as our state, like many states, has legalized recreational marijuana and also allows for a medical marijuana card. And so we are taking a look at what that should look like. We don't have a zero tolerance policy in place at this point, so it would probably reflect our use of alcohol kind of policy. And I'll tell you a story from someone else that made me really think about this. Is somebody I know said to me, well, I had an employee on a Zoom call and and that employee was smoking a joint in their living room while they were on a Zoom call. And she said, in our state, it's legal to have possession. It's legal in your house. And she said, I wasn't sure what to say because we didn't have a policy in place. And I went, we better have a policy in place. So I think it's going to be, fairly vague at the beginning. We'll tighten it up as we need to and move along. But I just wanted to add that as something that, because of Zoom, we never had to think about these things, but now we're trying to think about them a little bit more. So I'll stop there. Thank you.
Sarah, I have Lisa, I have a question from Sarah, and she wanted to clarify, is this a policy only for fully remote staff, or is this for hybrid? Will it be continuing on if you do hybrid?
The technology staff type end, yes, we're in that mode now. We don't have all staff going into the office all days. So some staff, because they're half time at home and half time in the office, is getting a half of the amount that they used to get. And while other staff are more fully remote, and because their jobs allow that, and so they're getting a different amount. So yes, there is a variation.
Thank you.
I guess this means it's my turn. Thanks for the opportunity to be here today and talk about a couple of policies that we have implemented. I do want to say that we at Wisconsin Family Ties, that we didn't make any policy changes related to COVID other than developing a specific reopening policy tied to public health guidance and scientific evidence. The reason for that is that we are a geographically decentralized organization to begin with. We're statewide, and most of our staff work out of their home offices and serving families in their local communities. And so we've operated as a remote kind of virtual organization for most of our existence, actually all of our existence. And so we didn't have a whole lot of changes from that perspective. But I do have a couple of policies to share with you today, and hopefully a few of you will find them of value or use. So the first one I'm going to talk about is our paid time off donation policy. So unfortunately, I think that this kind of came about a number of years ago now, 14, 15 years ago, where we had an employee with a serious health condition to the point where she no longer could work. She had been a valuable employee, a long-term employee, and we were very concerned about the well-being of not only her, but her family as well. And so we decided to implement this paid time off donation program. It is a voluntary program, and it allows employees to donate the value of their unused paid time off to coworkers in need. We even though we're smaller than the threshold for being subject to the Family and Medical Leave Act, we did use the FMLA definition for a serious health condition. Let me just pull that up quick here. It's pretty broad. In FMLA, defines a serious health condition as an illness, injury, impairment, or physical or mental condition that involves inpatient care in a hospital, hospice, or residential medical care facility, or continuing treatment by a healthcare provider. So a pretty broad definition, which serves the purpose perfectly for us, and we didn't have to come up with our own definition for that. Employees can receive up to 960 hours of paid time off in a 12-month period. That's 24 weeks. the employees who are donating can donate up to 50% of their PTO balance. We do have, they can't exhaust their paid time off balance. They have to leave some in there for their own use. And the policy also prohibits the direct soliciting of coworkers to donate to an employee's paid time off. This is one of those policies that you write and you hope you never have to use. Unfortunately, I've been there almost 20 years and we have used this more than one time. We've used it multiple times. And in all of those situations, I think that it's been an incredibly beneficial benefit to the employees and their families who needed this. And we never had a problem with people just wanting to donate PTO to others. So it's been a really effective policy for us from a need standpoint, but it's also something that, to be honest with you, I've never seen anywhere else. And so it becomes, I think that in nonprofits, and particularly human services nonprofits, nobody's joining our organizations to create wealth. Well, this is a benefit that is kind of unique that can help attract people to an organization that may not pay as much as some organization in the for-profit world. So the other policy that I wanted to mention is what we call our child and family protection policy. And this came about when we started getting questions. Our state made some, I'm not going to get into the details of it, but our state made some changes in the way that our services were funded. And Wisconsin is a county-run state. So the state develops frameworks for programs, but the counties have responsibility for them and they have great leeway in how they implement those. So instead of just one entity or regional entities that we have to deal with, we have 72 counties and 11 federally recognized tribes in our state, and they all have a great deal of independence. So the counties that we were working with started to become asking questions. I shouldn't say they became concerned. They started asking questions about our status as mandated reporters. We are not, and we like it that way, and we think that's the appropriate thing for people who are providing peer support. Peer support is based on trust and confidentiality, and if we were mandated reporters, it would give us far less leeway in how we handle that. However, we also recognize that we have a moral obligation to ensure everyone's safety. And so we put together this policy that we were able to combine our response to abuse, the potential of abuse, neglect, or suicide. And the policy protects employees that follow their training and exercise good faith efforts. It protects them from any kind of retaliation from the company. They're already protected from any kind of legal ramifications by the state. And it also has been able to assuage the fears that some of our system partners have had that we were that we were somehow going to let some egregious act slide. We also, in the policy, and Gail has these two policies and they'll be sent out to everybody. We also have a very specific section about confidentiality and the need for confidentiality in peer support work. And, but there are limitations to that. And we discuss those limitations with the families that we serve. And the policy even requires our staff to, if there is something that needs to be reported to authorities, that we will notify the family that we are going to do that, unless doing so would actually put someone at greater risk of harm. So those are the two policies that I have to discuss, and I welcome any questions on those.
Hugh, Joni asked, I thought all adults were mandated reporters. What information can you share that supported your belief that your staff are not mandated reporters, nor the support parents?
Yeah, well, I can't say what other states do, but in our state, there is a statute that identifies mandated reporters by role. So, school teachers, for example, social workers. So if you're licensed as a social worker, but we are not included in that. And that's the way that we think that's appropriate. And we've continued to, we use this policy as evidence that what we're doing works. And if we were to become mandated reporters, we believe that would be detrimental to the work of peer support.
Thank you. Lisa Lambert says, our staff in Massachusetts are not mandated reporters either, and we have a similar statute. All right, well, thank you very much.
Thank you.
Remember, you can keep these questions going, and at the end, we're going to open it up so you can ask questions on your own. Michelle?
Hi, everyone. Welcome to Wyoming. Uplift has served families since 1990. And amongst our beautiful scenery and plentiful wildlife, you may encounter a stigma of mental health and also a Western mentality of every man for himself. What doesn't kill you makes you stronger. Suck it up, buttercup, which makes advocacy especially important in our state. We, of course, like you, view families as change agents and think that just families are very adept at finding silver linings. And so COVID did bring some opportunities for us to make adjustments to two policies that we already had. And that might just be something you'd like to ponder if you have not. Next slide, please. All right, so we had policies around health and safety and social media that both needed a reexamination during COVID. First of all, health and safety. So like many of you, when we were able to do in-person work, we had safety protocol in place about how that would look as far as sanitation, distance, and masking. That worked very well for us. And then Wyoming was one of the states that lifted a lot of those precautions quite early. And because we also function as Wyoming Family Voices and have maybe an increased clientele that does have some medical fragility, we really took a good look at what families were saying as far as their comfort level goes with returning to in-person work without those protocols. So we've adjusted our policy to include using those protocols when a family requests those. And so we don't expect to change that anytime soon. We had some families that did recognize, even if they didn't have a chronic condition, that their family seemed healthier during that time. And so we are happy to continue business in that manner. The next thing that happened is because of Wyoming's political status and such, we had to re-examine social media and what that looked like for us. And so there were some posts on our social media outlets around things like vaccination and also some political posts that resulted in a little pushback from some community members, as well as some a reason to view our health and safety in a different manner as far as employees at Uplift. And so we decided that not only for Uplift staff, but also for families, we'd re-examine social media policies. And so we looked at policies for our agency. And when you do that, I think you really want to make sure that you're looking at who can post and then who's moderating posts on your website or whether they're being automatically scanned through Facebook. I think our social media policy was pretty bare bones in the beginning and more around how we would use people's information that's shared on social media versus the content. And so and our new policy makes sure to reference that this is in addition to any other technological policies we have around email, computer use, and such. And for employees, we've recommended a disclaimer on their own personal social media that states who they are working for, but not that they're anything expressed on their page may be, is not necessarily the view of their workplace. We also talked about not posting things contradictory to information on our website or our mission. And then other things, ethnic slurs, offensive comments, obscenity, things that you shouldn't have to spell out, but I think there's been a time that we need to revisit, just making sure that we understand that. And then around policies like information in regard to religion and politics. And so we've just asked that staff use their best judgment as well as a disclaimer around those areas of support. Any questions about those two policies? Thank you.
Okay, thank you. Paul?
So I'm Paul Cornells. I'm the executive director at Alaska Youth and Family Network. And when Gail called me about what she was trying to put together, and she asked if we had changed any of our policies or our approaches to staff, we actually haven't changed one policy. But what we recognized early on is that because of the population that we serve and the nature of the work that we do here at AYFN, COVID had the potential of leaving us with no staff in a really short order. Our staff are single parents. They're people who have had very recent or still have involvement with child welfare and the Department of Corrections. We have staff who are tied to the Polynesian and Alaska Native communities, which were disproportionately devastated by COVID here. So and our staff don't make a whole bunch of money, right? So our contracts require that most of our service that we provide here at AYFN is provided at home in the community, which kind of tipped things upside down immediately for us because we couldn't send our staff safely into homes, and community settings were kind of off base. So what we did immediately was we sat down with our leadership and our board and we said, hey, this is not going to be good for our staff. And how do we live our values? How do we extend the values that we live every day when we're asking our staff to support families from the community? How do we, as an organization, live those now? And what we decided pretty early on was that fair was not always going to be equal, right? We had families who had very young children whose daycares were closed down and they needed to work, but they also needed to have some way to accommodate their children. And so we started doing things like early on, we let them flex their hours, right? So they would provide direct care during the day and do their documentation and the other things that they needed to do on the weekends or after hours. We started doing a child care share here where staff would take turns supporting one another and taking care of one another's children. Our offices are still open to, even though we're pretty much back to normal operations. Our child care community, right, our daycare system here has been devastated. It's turned upside down. Half the daycares that we had before COVID, they don't exist anymore. is childcare is really hard to get. So our staff are bringing their children to work. And everything here has kind of been on the honor system. In the beginning, though, it was really difficult, right? So one staff member would see another one. I think early on, we paid for childcare. We allowed, we paid parents to sit home and take care of their kids and try to figure out our staff, you know, how to figure out how they're going to get okay and develop the routines they need to develop to keep their families safe and healthy. This created a challenge for us, right? In that all of our contracts and our grants required us to provide this direct care and direct service, and they didn't allow for us, to pay staff who weren't providing that care. So my board decided early on, AYFN's board of directors decided early on that, at least in the beginning, we used our unrestricted to pay families, to pay parents who were not able to provide that service, while in the background, we were negotiating with our funders to have more leeway and to allow us to develop alternative pathways to serve the families that we're serving, to continue to pay them. I think what's been really interesting study for us, and I don't know that I would encourage everybody, we have 20 staff here, and since COVID started, we haven't lost one, not one person. That first year was, man, every day I just wanted to go home and, decide that COVID was the reason I was going to stay home just like everyone else and not keep coming at it. But what happened after that first year or so is our staff became kind of role models for the community, right? Because they were supporting one another. Our organization supported our staff when other organizations were letting them go. Our staff were stepping in and stepping up and doing things that other organizations were shying away from. And as a result, we're growing. And before COVID, I had no idea what was going to happen. I was fairly certain that we were going to shrink pretty significantly. And now we're running 3 different pilots here. We're expanding across the state. We're in hospital ERs, and we're going to be in a lot of the community mental health centers. We'll have staff. And it was all because we sat down and took the time. And I think, especially on the part of our board, made a significant effort to decide that we were going to support our staff the same way that we asked them to support our families. So, but it's a tough conversation to have over and over again. I had people early on coming in my office saying, well, you let Susie do this, and, I want to do it too. Or, especially for our, around the bereavement policy, I heard, Lisa mentioned that. For our Polynesian staff, especially, man, everybody here is related. It's a very small community and everybody's related. So in very short order, our staff knew way too many people who had passed away. And it wasn't just that they needed 3 or 4 days to attend a service and to grieve. In very short order, the impact of having so many people that so close to you pass away impacted their mental health and their ability to function. And if we hadn't been able to be flexible, we wouldn't have been able to support them, because our policies here did not allow, we did not have a contingency in place for this sort of situation? How do you plan for it? So I think that's it. You know, the conversation is worthwhile. Fair is not always equal. And you know, reminding your staff that, reminding the community of that.
Thank you, Paul. That's pretty impressive. You're getting a lot of comments and praise in the chat box about not having staff leave. So thank you for really sharing that.
You're welcome.
We have a couple of questions. I know one statement. One of our family leaders noted that how Hugh noted the difference in how parent peer support providers, family orgs approach situations of abuse and neglect while still recognizing the responsibility. So they said that that was a great way of doing it, Hugh, and just to make sure that all staff are trained on how they approach mandating reporting in such situations and how to get support from supervisors in addressing the situation. And I couldn't agree more.
Hey,
We had a
Gail,
question. Go ahead.
so if I could just comment on that for a second, because I think that was in response to a question about what if a person is a licensed clinical social worker, but doing a parent peer support role. And our statute actually says, when it lists who are mandated reporters, it says a person or a child seen by a person in the course of professional duties. So our position is that, yeah, if you are an LCSW, but you're not working as an LCSW, if you're working as a parent peer support worker, then this statute doesn't apply to you. Now, have we ever had to test that out? No, we've not tested that out. And then I think, you know, that the comment that was made about the training, when you see the policy that Gail has, you'll see that there are obligations right in the policy for the organization to provide training in specific areas to our staff. And it included all of those things that were mentioned in the comment in the chat.
Thank you, Hugh. We had a question for Paul. Does your insurance cover children? Your injury policy, does that cover the children being at your workstation?
It does, because our insurance company, our insurance costs are just astronomical because of the work that we do and the people, right? Just like everyone else. It does, because most of the children that our staff children are also clients here in some way. They're supported by the organization in some way. All of the staff that we hire are, you know, just like all of you, are parents who are raising children that have, you know, in most cases, significant behavioral health needs. So our insurance does cover them. Where it got kind of, where it was a negotiation was when staff children were under the direct supervision of their parents, right? So if I bring my child here and I'm the person that's solely responsible for providing that supervision, there was a question about whether or not the organization would be covered under our liability insurance in that situation. But so far so good. And we have a wonderful insurance carrier who's been working with us for forever, and we have been able to do things because of that relationship that other peer organizations in the state can't.
Thank you, Paul. I would love at this time for people to go off mute and ask questions, come on camera so we can see your face and share. This is a great time. I see a lot of family leaders and executive directors here that we haven't seen in a very long time. So it would be wonderful to have an open dialogue. Any questions from anyone any thoughts or even policies that you want to share that you think are pretty interesting that everybody else could learn about?
I wanted
Gil,
to share the comment that Teresa Wright Johnson mentioned, and she said, and you all sound like that you all model peer support and self-care for peers. This is true peer leadership.
Yeah, it really
Mhm.
is.
Gil, can I make a comment? Paul reminded me when he's talking about bereavement. So during COVID, sometimes there was a death, but the service wasn't till later. We consider that still part of the same thing. And also, we continued that even though that isn't the case anymore, because sometimes people live all over the place. There might be a death, and then you go to wrap up, close a house, or, that's still part of bereavement under our policy. And then lastly, I just wanted to mention this, having 3 days when your mom dies, which has happened on our staff, is totally inadequate. So we wanted to recognize that as well.
Mhm.
I have something. One of the things that I implemented in my small federation chapter, because we're in Georgia and I am an executive director of my chapter, but I also help other leaders as I'm a leader. And one thing is our families, they missed eating together. So they missed having that food together. So we implemented in my chapter and some of the things we've been doing in other places, ways to still deliver food to them, still do the Uber stuff, drop off food to families. And because a lot of things here just kind of shut down, and they're like, hey, well, they can't get food anymore. And some of those families were looking for that connection, but also they miss being with adults. I love, Paul, when you said about the insurance, because I hear that as an excuse a lot about why we can't provide childcare. So I'm almost interested to find out more about what insurance company that is, so I can see if we have it here. But I'll be asking more of that to some of the insurance agents that I know, because many of our parents, they're like, hey, well, none of the parents are showing up for these support meetings because they don't have childcare. Or maybe, I've been virtual way before now, so I like virtual, but it was because of those things. So I'm glad to be here and actually take some time to listen. Because all of you gave very valid points in that self-care piece. There, you all were providing self-care as someone that still works in the field, not just as a leader, but in so many other ways. It was a breath to ears, because I'm fussing with some organizations like, hey, y'all want us to go help families, but y'all aren't providing self-care for us.
Mhm. Good points, Teresa. Paul, by any chance, do you have, and I don't want to give you homework, but people know me, I always have something for someone to do. Is there language in your insurance that you can kind of copy and just share with us as part of our follow-up? Obviously, that's not anything mandated, but it might be, if you have some special language, people can use that to actually talk to their insurance company and say, well, this is the language I heard. Can we have some kind of insurance like that?
Probably. I think part of it was the relationship. So here, almost everybody that we hire now, all the parents that we employ, they require variances to be employed to do the work that we do, because at some point they had a substantiated child welfare case against them, or they were in prison or jail or both. So when we approached our insurance carrier and said, hey, we want to employ these people and we want to employ them, to do this one-on-one in-home service for other vulnerable families, oh, man, I got shut down immediately. But over time, we've had this conversation, and now we have very good insurance coverage that allows us, our staff, to transport children that are not their own, that covers us moving in home and in the community, covers us in case of inaccurate reports of harm being filed, right? Because those can cause damages to families that then have legal repercussions. So I think for us, it was finding the right insurance agent and then them finding the carrier that was willing to have those conversations. So I don't know.
I got a private text asking if you could explain a little more, or if anyone here today can answer this question. They are asking, what is your staff's policy on transporting parents with family peer specialists? Their organization does not allow that, and they have to meet with people at
We do.
designated sites.
But we live in Alaska, so we live in a really spread out rural state. And most of our families don't have transportation or reliable transportation. They have requirements, especially around child welfare, that case plans that have to be worked that require them sometimes to have many appointments in a day. And when they're not working those plans, they don't get their children, or they don't get to keep their children at home. So we transport as a matter of necessity.
Can
And
anyone else share too? Lisa?
Right, okay. We transport as well, and we make sure that it's covered in our insurance, and we also allow our youth move leaders to drive other youth as well.
Okay, wow. And Joni says Oklahoma does not transport, but will provide an Uber card or a gas gift card. Any other thoughts about that? I mean, I seem to be getting a couple of questions, so I'm sure everybody's interested in that.
Hi, everybody. This is Ruth from Pittsburgh. Good to see a lot of faces I haven't seen for a while. But I just wanted to talk a little bit about transportation. We do have parts of Allegheny County, which is the part that we serve in Pennsylvania. And we have rural parts of that county that don't have bus transportation or anything like that. Our families do transport. We require that to work with us, they have an automobile that's reliable, and they have to get insurance that's 100,000, 300,000. And then we do have secondary insurance that will pick up as well. So that's what we do so that they can transport families when needed. Our philosophy is do for, do with, and cheer on. So we help them figure out transportation in other ways as well, if it's possible. But we know that sometimes that's just not possible. And so we step up to the plate and do what we need to do. In the city, of course, we give bus tickets and things like that so they can move around where there's bus transportation.
so here in Alaska, when we first started transporting, like Ruth, we have the same requirements. Our staff have to have the 100, 300, and then we have an umbrella policy that would cover anything above that. We had a staff early on that got in a fender bender, and she told her carrier that she was driving for work, and her carrier refused to cover her because she had not told them when she increased her policy limits that she was increasing them because she was going to be using her car for work, and that she was transporting clients, right? Transporting parents and children for work. And there's a little bit more of a cost that insurance carriers charge individuals when they say they're using their vehicles for work, and we cover that. In most cases it's really small, $20, $30 a month, but for some of our staff that can be significant. The risk in not doing that is that you could have a significant claim that would not be covered. So I don't know how everybody else's states are, but here it's absolutely a requirement.
So when you hire someone, do you say that you have to get the 100, 300, and you have to tell them why?
Yes. Right.
That was my own question. Anybody else for any questions or thoughts or something to share? Because we don't get this opportunity to see us. So please, let's share our ideas.
Hi, this is Carrie Megley from Family Ties of Westchester. We're in Westchester County, New York. So while, yes, we have many urban areas, we have staff that don't have their own cars, and a lot of the family members we work with don't have their own cars. So our insurance does not allow us to drive family members in our own cars. So I'm interested in learning a little bit more about this. And is it a requirement, Paul, for your staff that they must have their own car and they must drive people, and you pay the differential in the insurance? What if a family says, I'm not comfortable doing that? Or what if a potential staff person says they're not comfortable doing that?
Well, yes, it's a requirement that all of our staff have their own vehicles and are able to drive because of the nature of where we live.
Right.
And the requirement that a lot of the meetings that our family support people attend have to be in person. Whether or not a staff member is required to transport somebody when they express a discomfort in doing that, if it's a general discomfort, I just never want to transport families, that's an issue. But if it's a specific family or a specific issue or safety concern that they have, then we look at that one-on-one. And generally, we won't force require a staff member to transport someone that they don't feel safe transporting.
Sure. So it does not have any effect on your agency liability that you have staff members driving families around? It's all on their own individual insurance?
No, absolutely, it's not. The only portion that would be on their individual insurance is the physical injury liability, right? The first 300,000. Then the rest of it is ours. But we have, there's other risks to having staff, especially staff with the legal pasts that most of our staff have had in transporting children, right? So one of the biggest risks that we face, and the reason that the state requires us to get employment variances for folks, is that they've already had trouble in their pasts with neglect or maltreatment of a child, right? Or they've been in prison for causing harm to somebody in a vulnerable population. So yeah, our insurance company has every year it's a negotiation, and our insurance is pretty expensive. We build that all into our contracts and our grants.
Right. That I think would be prohibitive for us. We have to have, I'm looking at somebody else, we have to have clean driving record. They have to pass the state central registry. We wouldn't be able to afford the insurance on people we would love to hire that have that lived experience and have come out the other end, but our insurance won't allow us to do that.
Our state is kind of jumping in with both feet and their eyes closed into this into peer support now because of our workforce issues. So we've had really good luck and a lot more influence than we've ever had in getting the state to recognize the financial burden that comes along for an agency when they're hiring the types of peers that the state wants us to hire.
Yeah, thank you, Paul. And we have this hour always goes so fast. We have time for just one question left, and it goes to Michelle. And it says, have you ever had to delete staff posts from your social media because they were inappropriate? What if it's a parent post on your social media? What happens?
Okay, so thankfully I have not ever had to delete a staff post, and the refining we did of our social media policies was really to protect our staff, because someone had posted some derogatory information about a staff member that was false on our social media. So instead of delete that, we decided to address that as a board, and our board president chimed in on that post, and then we followed up with a link to our discrimination policy, which worked well for us. I've only had about twice where I've had to delete a post from, I don't know if it was a parent, it certainly wasn't a parent working with us, but with profanity in it. But besides that, we've been very lucky. But it is one thing that we really talk a lot about in staff training, to stay on top of that.
Well, thank you, Michelle, and thank you, Hugh, Lisa, and Paul. I hope this was informative and helpful. I certainly learned a lot. A special thanks to the NFSTAC staff for helping us run today's event smoothly. Now, I want you to come in May, on May 26th. Mark your calendars, because that's our next office hours, and we're going to talk about spotlighting your family-run organization, strategies for marketing in your community. And this is one I know as a former ED I struggle with quite a bit. So we're going to have a marketing person to present and kind of talk about it in the point of view of being a family-run org, and come with your questions and also information, because you have ideas. We're not the keeper of all ideas. So please share your ideas and come and join us on May 26th, same time, same channel. And now I have a request for you. I mentioned at the top of this event, please take some time to fill out our survey. When you exit this event, you'll be redirected to that survey site directly there. And after you finish the survey, you should have a certificate that pops up. So thank you for coming. Feel free always to contact myself, Lachelle, or Dr. Gargan. Thank you very much. And we'll see you next month, May 26th. Bye-bye, everyone.